Good evening, everybody. Just want to say hi and welcome everyone to our webinar. We'll be beginning in a moment. Hi, everybody. I'm Carol Mershart, and I'm Access's Executive Director. I want to welcome you to tonight's webinar about testosterone replacement. We want to thank Clarus Therapeutics, who has sponsored this webinar series for us. We really appreciate all of their help. The mission of Access is to help individuals with one or more X or Y chromosomes and their families to lead fuller, more productive lives. We do this through support, education, research, and treatment. You can visit us at genetic.org. We want to make sure you know about our Access Clinical and Research Consortium. We have clinics in over 14 areas, and we're new in 2020. We are adding clinical research members from NIH and other areas, and also clinics that are in Europe. Access holds in-person support groups, or we will once we're able to meet in person again, and you can find those on our website. We also have many Facebook support groups. So if you're not familiar with them, we suggest that you take a look and join us on Facebook and get some questions answered and just become a part of our community. The Access Helpline has a toll-free number, or you can email us. We're trained volunteers will respond with your questions. We pair callers with peers, and our volunteers will listen and help direct you to the resources that you need. Access also has a series of brochures. We are happy to provide those to you free of charge for you to share with schools, doctors, family, whatever use you need. Just shoot me an email and I'd be happy to send them to you. If you're on our website, we encourage you to look at our library. We have many research articles, plus our news and newsletters on various chromosomal conditions. And it's just a great place to find out what's new and get the information that you need. This webinar will be posted on YouTube, as well as right now we have over 100 webinars and recordings from past conferences with topics from fertility, disclosing the diagnosis, mental health. So we encourage you to find us on YouTube and check out our webinar series. And lastly, I want to invite you to consider joining us for our 2021 Access Family Conference, which will be a virtual conference next year. And we'll let you know more about it. You can see it on our website, and we'll be sending you in our newsletters. So without further ado, what I'd like to do is introduce you to our special guest, Dr. Jay Newmark, who is the Chief Medical Officer from Clarus Therapeutics, and he is going to tell us about testosterone replacement therapy. Thank you, Dr. Newmark, for joining us.
Thank you. Am I sharing my screen with you?
Yeah, it looks great.
Perfect. Okay. Well, good evening, everybody, and thank you for allowing me to speak to you tonight and talk to you about this very exciting advancement in testosterone replacement therapy, and to talk to you really about testosterone replacement therapy in general. As Carol said, my name is Jay Newmark. I'm a urologist by training and am the Chief Medical Officer at Clarus Therapeutics. The effects of testosterone have been known for quite some time, or rather, I should probably say the absence of testosterone has been known for quite some time. Aristotle was the first person to document the effects of the lack of testosterone, back many years ago, and noted the effect in both humans and animals. The absence of testosterone effects was used in many cases over the years, and you're probably familiar with the practice of castration of boys in order to allow them to sing at with a higher voice, soprano or alto voice, but allow them to have the acoustic volume of an adult male. These singers were known as castratos. And Alessandro Moreschi, that you see pictured here, is known as the last castrato because he's believed to be the last one who sang in the Sistine Chapel back in the early 1900s. Since the since the effect of testosterone was known and was believed to cause many positive effects in men, and including virilization, and there's been a search for effective means to supplement whatever that was. Testosterone wasn't known over the years, but the effects certainly were. And so early on, the men would try to supplement the effect by ingestion of animal organs. And it was known that testosterone or this effect was related to the testicles. And so the consumption of extracts of testicles from different animals and other organs was pretty widely practiced. It wasn't until the early 1900s when testosterone was developed, and it was synthesized about 1935. Once it was synthesized, of course, man tried to supplement testosterone with what it was created, and they would make testosterone and ingest it, but it didn't have much of an effect. The problem being that the testosterone that's ingested, while it wasn't known at the time, it would be ingested and then degraded almost immediately in the liver. So oral testosterone alone was not very effective. Soon after that, however, other formulations of testosterone were made in an attempt to create an effective oral testosterone therapy. This was accomplished by modifying the testosterone molecule in such a way that would not cause degradation of the molecule by the liver, at least immediately. While this was accomplished, the problem was this substance would accumulate in the liver and eventually was found to cause toxicity to the liver. So by and large, it's not used at all anymore. So since those years, we looked for other ways to administer testosterone. And the early therapies were injectable forms. Testosterone enanthate, cypionate, and other testosterone esters. And then, of course, later, other preparations that were applied to the skin to absorb testosterone into the body. And I know you're probably all very familiar with these. As I mentioned, we have testosterone injections, and I'll just point here to the subdermal preparations, which are like the pellets that are implanted periodically under the skin. This has been something that's been around for many years, probably 60 or 70 years. Closer to the 1990s, we started to see newer advancements using some type of a topical gel or a cream, either as a patch or as a gel that's just applied to the skin, and over the day, the testosterone would be absorbed through the skin and have an effect. There were also some unusual types of patches, such as applied to the gums, where a small patch is placed and stuck right on your gum line, or an application where a gel is injected up into the nose or applied within the nose. And all of these were effective, but I'll just tell you from my own experience as a practicing urologist many years ago, when I first started seeing all these different types of therapies, the first thing that crossed my mind is, well, where's the pill? Why don't we have a pill? I mean, why are we doing all these other things when a pill's the simplest thing to that one can do? Well, since I've been at Clarus Therapeutics and working with our CEO, who's the inventor of Jatenzo and was also a co-inventor of androgel. I've learned how challenging and difficult it is to create an oral testosterone that will provide adequate drug levels throughout the day and be safe and effective. And you might be aware of, if you've used these products or if you've known somebody who uses these products, they all have certain disadvantages. You know, I suppose that's true with anything. But I think it's important to know that whatever you've been experiencing with these products, if you've been using them or if someone you know has been using them, it's important to know that you're not alone. The Harris poll conducted a service on behalf of Clarus Therapeutics earlier this year to look at issues related to TRT therapies and really to learn about patients' experiences with these medications. And I think one of the conclusions from these surveys is that it's important to talk to your physician about problems that you have or experiences you have, because it's important to know that they're very common. The problems with them are very common, and your physician or healthcare provider is there to help you resolve them and find a treatment that works best for you. And at Clarus, we're here to help you. As I said, the CEO of our company has really dedicated his life to androgen therapies, and is initially starting out with androgel, being a co-inventor of androgel, and then taking on the task of finding an oral therapy that we use today and is called Jatenzo. He's been in this industry and in this kind of development for over 30 years. It took over 15 years to develop Jatenzo. And having been at the company for the past year, I learned a lot of the challenges that they had to overcome in the process. So I want to talk to you a little bit about Jatenzo now. I know we'll have time later after the presentation to answer questions that you may have, and I'll be more than happy to answer whatever questions you do have. So Jatenzo is the first and only FDA-approved oral testosterone replacement therapy with a molecule called testosterone undecanoate. It was developed for men who have either low or absent endogenous testosterone that's due to certain medical conditions. It's approved by the FDA, and as you know, it contains testosterone. This is a controlled substance. Some of this is repetitive, but it's used to treat adult males who have low or no testosterone due to certain medical conditions, if you didn't catch that the first time. It's available in 5 different dose options, and the pill comes in 3 different strengths, 158 milligrams, 198 milligrams, and 237 milligrams. These options allow your healthcare provider to titrate the dose that you receive to the therapeutic effect and to what you need. It's quite simple to take. It's an easy to swallow soft gel taken by mouth twice a day with food. It doesn't matter what kind of food you take with, but it's really best to take it with some food, as it does assist in the absorption of Jatenzo. Let's see here. So a little bit of safety information that the FDA requires to review. I think on the left side here, I've gone over this already, but it is important to know that Jatenzo was developed and studied in males over the age of 18. So it hasn't been approved for males under the age of 18. There could potentially be an effect of Jatenzo on bone growth. This is true for all testosterone products, and healthcare providers are very aware of this. The most important safety information you should know about Jatenzo is it does have a black box warning. This black box warning talks about increases in blood pressure. And the concern there is that if your blood pressure is increased, it could potentially have adverse cardiovascular effects, such as heart attack or stroke, or risk of death due to heart attack or stroke. So, these are things that your doctor will be aware of and will, of course, want to monitor blood pressure when patients are on these types of medications. And patients who have pre-existing high blood pressure, of course, while they're getting their blood pressure followed, on a regular basis, it'll continue to be followed here, and they may be in need to adjust medication while they're on Jatenzo. If there's a problem controlling blood pressure while on Jatenzo, some patients may not be able to continue with it, and it would have to be stopped. So I'll have some more information along those lines later, but I want to tell you why Jatenzo works and what makes it different. So as I mentioned here on the left side, this is just to let you know or remind you that Jatenzo is taken twice a day with food, where it goes into the stomach and in small intestine. And unlike other molecules and testosterone, when it's just taken by itself, where it goes right into what we call the portal circulation. This is a circulatory system that goes directly to the liver from the intestinal tract. And it's important because the liver is a detoxifier, and anything that's ingested, the liver can rapidly detoxify, and that's the purpose of this. The liver also is involved in helping store different nutrients like sugars. It creates, from glucose, it creates what we call glycogen, which is stored in the body, so it can be used later after someone's finished eating. So it does have purpose, a beneficial effect. However, in the case of testosterone, when you take testosterone alone, the testosterone goes to the liver, and the liver sees it and starts to metabolize it or break it down like it normally does. So taking plain testosterone can't have a good beneficial effect if you take it that way by mouth. What we've done with Jatenzo is create what we call a testosterone ester, which is a larger molecule that attaches a fatty acid onto testosterone, and this fatty acid is undecanoate, and this compound makes it very lipophilic, or a lot like lipids. And lipids are handled by the body differently. Lipids don't go directly to the liver. Rather, they go into the lymphatic system of the intestines. And they're taken elsewhere and released into what we call the systemic circulation, where in the case of Jatenzo, the testosterone undecanoate acts like a prodrug. That when testosterone undecanoate is in the bloodstream, there are esterases or enzymes that will break off the undecanoate portion and release the active testosterone molecule. This then circulates in the body and will have, just like endogenous testosterone, will reach the organs that it's designed to have an effect, and will exert its effect, and eventually, like endogenous testosterone, what your body makes, it will eventually be broken down and released from the body. And because of this, since it does not go through the portal circulation, you are able to have a good drug level or testosterone level after taking Jatenzo. And unlike the other oral types of testosterone, we have not seen any type of liver injury related to this. And in fact, other forms of testosterone undecanoate that have been used in Europe for 30 or 40 years have not had this issue either. So it does not appear to be something that we're concerned about with this particular form of testosterone. Let's see here. As I said, Dr. Dudley, my boss, has been working on developing Jatenzo for, it turned out to be 15 years. We have several late stage or phase 3 clinical studies. The registrational study is what we called In Tune. And in this study, we looked at, as the FDA would like to see, when patients are started on Jatenzo, by the end of a period of time, how many patients are within the normal eugonadal range, or do they have a normal testosterone level throughout the day? And in this study, 87% of men who were treated with Jatenzo had a normal level at the end of the treatment period. So that's an excellent result. It's much higher than the minimum that the FDA requires. And so we were very successful in that regard. And we looked at this in our other late stage studies, and we saw similar results. As you'd expect with any drug, Jatenzo does have some adverse reactions. These are the most common ones that occurred in less than 2% of, in more than 2% of patients. So what you see here is in the parentheses, the percent of the patients that were affected. So the most common problems we saw were headache in just under 5%, an increase in the hematocrit or polycythemia in just a little less than 5%, hypertension or high blood pressure in 3.6%, a decrease in HDL or the good cholesterol that you've heard of in about 3% of patients, and nausea in 2.4% of patients. Of course, there are other adverse reactions that were seen in patients, but less than 2% of patients in the study. So these are the most common effects that we saw. And as you see here, other common effects included, well, the blood cell count, blood pressure. In some men who had prostate glands that were enlarged, they might have had some trouble related to that. Diarrhea, heartburn, foot, leg, ankle swelling, burping, and as I said, nausea. We're trying to make Jatenzo as easy as possible for patients to get, and we're doing that in in many different ways, really. We are reaching out to health insurance companies, trying to get them to cover Jatenzo, which shouldn't be a surprise, but we've had good success so far, and we're continuing with that even through this pandemic process. So we have that. We're improving our coverage, but we also have what we call the Jatenzo Go program. This is for patients who have eligible commercial insurance. In some cases, a patient would pay as little as nothing for their monthly prescription. And we also have mechanisms in place to help doctors' offices go through some of the challenges that they face to get patients coverage assured and approved so that patients can get their hands on Jatenzo. So this is something you can ask your doctors about. This obviously they're very interested in this, and we talk to them regularly so they can learn more about it and reach out to us if they have questions or difficulties. So when I was in practice, one of the things that I would tell patients about who are on TRTs and other conditions too, I would say, why don't you keep a diary, a daily accounting of your experiences while you're on this medication, or if it was a treatment, this treatment. And I think it's a good idea for patients who are on testosterone replacement therapies. So, you might ask yourself these questions. How are you feeling on that particular day? Are your symptoms better, or are they worse? Are you having any side effects related to your treatment? And then, of course, what symptoms, what 3 symptoms are the greatest concern to you? That way, if you keep a log, when you go talk to your doctor, you won't have those moments where you totally forget what you wanted to say, and then you leave the office and say, darn, I wanted to ask that. So if you have it written down, it's much more efficient for you, and you'll get your questions answered. And of course, knowing what your current dose of the medication is and what medication you're on will expedite things too. Of course, your doctor will have your chart in front of him or her, but if you know it, it's going to make you the more informed person to have these conversations with your healthcare provider. And let me see here. So I've got a little bit of safety information to go through. Some of this is repetitive, and I'm not going to repeat everything, just because you've heard some of this before. But yeah, the FDA requires it, and of course, if there are questions about this after we get through the discussion, I'm more than happy to talk to you about this as well. So as we've said, Jatenzo is a prescription medicine that contains testosterone. It's used to treat adult men who have low or no testosterone due to certain medical conditions, and it's a Schedule III controlled substance because it contains testosterone. You want to keep Jatenzo in a safe place to protect it, and you don't want to share your medications even if somebody has similar symptoms. Of course, selling or giving away medication is against the law, and it can potentially harm others. Jatenzo is not meant to be used by women. It's not meant to be used by pregnant women. It's not to be used in patients who have breast cancer, who have known or suspected prostate cancer. Any patient who has an allergy to Jatenzo or any ingredient in Jatenzo. And it's really meant for patients who have Jatenzo due to certain medical conditions, and not just due to advancing age. Before you take Jatenzo, you want to talk to your healthcare provider, and this is true about other testosterones and other medications, but specifically here, if you have high blood pressure or being treated for high blood pressure, you want to let them know. If any heart problems, if your blood counts are high to begin with, if you have urinary troubles, or any kind of liver or kidney disease, if there's any history of mental illness, including suicidal thoughts or actions, depression, anxiety, mood disorders. And some patients who have a sleep condition known as sleep apnea. And as you might know, with other medications, using Jatenzo with other medicines, the two can affect each other. So if you're taking insulin or medicines that can decrease blood clotting or blood thinners, certain kinds of steroids, or medications that also can increase your blood pressure, like certain cold medicines or pain medicines, it's important to make sure your doctor's aware of this. They probably are, but if you're seeing somebody who's not familiar with you, they may not be aware of it, and so it's helpful if you can remind them. Of course, you want to take Jatenzo as your healthcare provider instructed you to take it. It's intended to be taken twice a day by mouth, once in the morning with your breakfast meal and once in the evening with your evening meal. Your healthcare provider may change the dose. Your testosterone level will be checked periodically, but you don't want to change your own dose without talking to your healthcare provider. We talked about the side effects that Jatenzo may cause. And, I don't think there's anything here that's new. So we will continue on to the next slide. I mentioned to you that some men who have an enlarged prostate, when taking testosterone products, their symptoms may worsen, and it can cause increased urination at night, or trouble getting the urine flow started, or trouble urinating during the day, urinating frequently during the day, or having a urine accident, etc. So that's something you want to make sure that you write in your diary, or maybe even let your healthcare provider know in advance. While there's no real increased risk of prostate cancer, that's really controversial. It is recommended by guidelines panels like the American Urological Association and the Endocrine Society that men should have their PSA, a prostate-specific antigen blood test, checked before starting testosterone, and then after they've been on it for a little bit, because this is a test that we use commonly to screen for potential prostate cancer or other kinds of prostate problems. There is a potential of blood clotting in the legs or lungs that can be seen with androgen therapy. The signs and symptoms of a clot could be pain or swelling or redness in a leg, or if it was in the lungs, it could cause trouble breathing or chest pain. I think, somebody who experiences symptoms like that would be in touch with their healthcare provider pretty quickly. And you're probably aware that testosterone is a drug that's been abused, and there's a great deal of concern about patients who abuse it because there's a potential that they could cause harm to themselves. If you have concerns about that personally, or if you know somebody you suspect might be abusing it, it would be worth letting a healthcare provider know. Medications like other testosterone products and possibly Jatenzo have the potential to lower a sperm count. So younger men who are interested in fathering children, this could potentially be an issue. So as physicians, we like to talk to our patients and make sure they're aware of this, and look at other potential options if they're considering starting a family. As I mentioned, there's some types of testosterone products can cause liver problems. The symptoms of this include nausea and vomiting, yellowing of the skin or the whites of the eyes, a dark urine, pain in the right side of your upper stomach area. And so obviously if somebody has symptoms like that, they'll be in touch with a healthcare provider, but it's worth knowing about. Again, this is nothing that we saw in any of our studies in patients using Jatenzo. In some patients, there can be swelling of the ankles, feet, or body, what we call edema, due to androgens and testosterones. There can be enlargement in the breast tissue. Sometimes it can be painful. And then I mentioned the issues with sleep apnea, which are breathing problems. For somebody who has that, it's important that they are being treated for sleep apnea, and that their doctor's aware of the issue before starting testosterone therapy. And then, of course, I mentioned that the changes in mood that can occur with these therapies. And I think we talked about the common side effects, but it's worth repeating. An increase in the red blood cell count, burping, enlargement of the prostate gland in men who have problems to begin with, diarrhea, foot, leg, ankle swelling, increases in blood pressure, heartburn, indigestion, nausea, and headache. Other side effects can include more erections than are normal for you, or erections that may last a long time. If any of the side effects bother you, obviously you want to make sure your healthcare provider knows about this. Keep Jatenzo and all medicines out of reach of children. We do have our full prescribing information and a medication guide. It's on our website. You can also find information at fda.gov/medwatch. And so with that, I'm going to pause and open things up for questions. And thank you for taking the time to listen to me.
Well, thank you so much for that wonderful presentation.
Sure.